birds and things and flowers.
Hey, Earl Stephenson Jr., you guys know this. I am your board certified Atlanta plastic surgeon, and I am coming to you exclusively in the community. This is streaming nowhere else. This is why you join the community so that you can get exclusive interaction with me. Once you watch this video, if you like it, leave comments below. I'll try to do more of this type of video. This is really informal. I encourage you to share the video if you really like it as well. So I wanted to jump on very quickly this evening before I wrap it up and head out of here. And I'm going to talk about something that's often done as part of the journey for any aesthetic surgery, and I'm going to talk about markings, and we're going to talk about specifically mommy makeover markings. So I drudged up a picture from years past of a client that I performed a mommy makeover on, and I want to go over the markings, their meaning to me, and the immediate on table result. I hope this gives you a bit of insight. So, if you're moving forward with aesthetic surgery, you kind of understand a little bit more of what the markings are, how important they are to the plastic surgeon. And again, just help you feel a little bit more comfortable about the processes of this journey. So let's pull up this picture. Wonderful. So here we go. So we have a young lady who was interested in having obviously some breast work done and tummy work. So this is technically a mommy makeover. She's going to have a breast reduction slash lift, some liposuction of her abdomen, and a full tummy tuck with muscle tightening or plication. A mommy makeover can consist of variations on a breast type of procedure and typically a couple of variations on the tummy. Commonly, the tummy is a tummy tuck with lipo. Occasionally, it can be just liposuction. So, in my mind, they are the two variations for the tummy. For the breast, it could be a breast lift with implants, a breast reduction, a breast augmentation, or a breast augmentation with lift. As we are kind of sitting here in 2024, there have been a couple of other things added to a mommy makeover. There's been a real uptick in genital aesthetic surgery. I don't perform that, but you can have reduction of your labia majora. And so that can help improve that area aesthetically if you believe that's an issue. You can also have some work done on your face as well. And that could range anywhere from liposuction of the neck, neck lift, neck tightening, facelift. Obviously, we would not perform, or I would not recommend performing a face and a body procedure at the same time. So, those are some components of a mommy makeover, but a traditional mommy makeover usually involves breast and tummy. And so for this lady, we have, or I did, the markings. So you have red markings, you have green markings, and you have purple markings. Sometimes I use various colors, sometimes I use one color. It just depends on the case, how I feel, and sometimes what's available. I typically try to carry my set of markers with me, but occasionally I leave them in the office or I leave them at my bag at home. And so I just use the standard markers that are provided either by the surgery center or the hospital. And that usually is just a purple marker. But be that as it may, the color really is almost irrelevant unless The surgeon has a very specific reason why he or she is using those colors and uses those colors consistently. The markings for me are just reminders and landmarks. So let's look at the red markings. Let's start with that. So you see a long red marking from the top or the of her collarbone in the middle, all the way down through the top of the vagina. And this essentially marks the middle of the body. This is a really important landmark. You want to make sure that this landmark is referenced because it's easy to get body parts off of the midline. Obviously, the most important would be the belly button for the tummy tuck. It's really hard to get the right breast over to the left and the left breast over to the right, but it does give you some reference point of the nipple. You don't want to have one nipple too close to the center and one nipple further away. That creates the appearance of breast asymmetry when you have nipple asymmetry. So it is important, but really important for the belly button. And I like to use it also for the tummy tuck skin. I really like to put the center where the center may be. Sometimes I will tailor the incision out toward the hips. I may bring it in a little bit and kind of tuck it in so that it accentuates your waist. But I really like to have the center of the lowest part of the tummy tuck incision to meet up with the center of the mons pubis. The outside red lines from the center on either side just kind of mark and are kind of an extension of the center of the chest, as you can see going up each side of the breast. It's just what we call a meridian, which is a reference line. I think these lines are a bit important, but they can be a little bit askew, especially in the tummy, because when you're or I'm lifting up the tummy, skin, sometimes I will pull one side a little bit more to kind of accentuate the hip, the waist area, and pull another side a little bit differently. And so when you line up those marks may be off at the incision line. And that's okay because that or those lines are just so that you can have a visual cue of the the side of the abdomen, but at the end of the day you're going to look at the shape of the abdomen and not the alignment of the marks down by the proposed green tummy tuck incision. For the breast, those red lines in the center of the breast are important. I really try to line up the nipples along that breast line so that the nipples aren't looking outward or not looking too far inward. So I really like to try to line that up as much as possible. The other red line component is a circular component of the upper chest or what I call bra roll, just between the breast and the arm. And this is an area that I believe bugs women immensely. It kind of shows through clothing. You try to wear something that has a little strap on it and it bulges over that or to the side of that. And so, what I've done is I've marked that area as a reminder for me to perform liposuction of that area. So, that's what that means. So, now let's look at the green lines. The green lines for the breast look like kind of a snowman. And this is the incision or removal pattern of the skin and breast tissue for a breast reduction. The green line at the bottom of her tummy represents the incision line for her tummy tuck, which goes kind of hip to hip. No one likes a long incision, but I find that most patients require this length of incision to really work the hip area, waist area, and the front of the tummy. Shorter incisions just don't do the job typically. Moving back up to the breast, the top part of that snowman is where that nipple will end up being. As you can see, that nipple is centered on that red line. Currently, the nipple naturally is out toward the outside of that line, more towards the arm. So we definitely don't want the ending nipple position to be there. We want it to be up in the center of that green portion of the snowman. The bottom portion of the body of the snowman is going to be the breast tissue that's removed around this thumb like island of breast tissue that's indicated by the purple mark. This is the island of breast tissue that the nipple will be kept on so it remains healthy. The nipple is not removed and placed on the table and then sewn back on in this particular case. That technique, when you remove the nipple and sew it back on, is called a free nipple graft. And it's a very old technique for a really, really large breast. I think it's fallen completely out of favor because the end aesthetic result is hideous. I know I don't do it. A lot of my colleagues don't do it. There are some of my older colleagues that still continue to do it because they feel it's the safest thing to do. I've been able to craft a technique where I'm able to preserve the nipple and extremely large breast reductions so that the natural native nipple remains and gives you a natural end result. This patient is not that. She's kind of your standard breast reduction. So what I do is I remove the tissue that is in the green part of the snowman head above that purple line. And I remove all the tissue around the purple line that is bordered by the green line. And that empties that space and allows me to rotate that thumb of tissue up into the head of the snowman and then close the bottom part or the widest part of the green area together to narrow and lift and project the breast. So, this technique is called a superior medial pedicle. And those fancy words mean that it's superior, meaning that the blood supply is coming from that little notched area of the purple thumb that's toward the center of the chest. So it's superior. And it's medial, meaning it's toward the middle. You can have or preserve nipple and breast tissue with an inferior pedicle. Just imagine taking that thumb like projection drawing and making it so it's straight up, where the bottom, where it's notched, is at the bottom of the crease, and the top of the thumb is pointing up toward the red line. That's an inferior pedicle breast reduction. I like a superior medial pedicle when I can accomplish this because it gives, I believe, a superior shape and a shape that holds over time and doesn't look boxy. So this is the typical marking for that. You end up with an inverted T incision, but this is how you start and mark it for that particular type of breast reduction slash lift. So these are the markings that I marked at that time. Let me tell you what I do a little bit differently. I still would mark the breast the same today as I did at that point way back when. I would mark the upper fullness in the armpit just to remind myself that I need to liposuction that area. I would draw my or mark my tummy tuck incision line as you've seen out there in green. I would definitely draw my midline in marking from the top of the collarbone all the way down to the top of the vagina. I wouldn't necessarily draw these red lines on either side of the middle red line on the tummy because again, I don't think they at the end of the day mean anything. You don't try to line those up. You just try to tailor the skin and the contour of the skin to make the waist and tummy look good. So these lines may not line up. So I think that's not necessary. What I would mark additionally on the tummy that you don't see here would be my areas of liposuction, which are typically above the belly button to help kind of craft and contour that area. I really try to create a shadow in the center part of the upper tummy to kind of give you that nice, sleek, fit, somewhat athletic look. I do try to liposuction along kind of in the same position where these red lines are along the edges of the six pack muscles that we end up tightening to kind of again give you that kind of sexy, fit, athletic look. I would mark my love handles and flanks and actually liposuction there as well. So you would see circles and drawings and to represent shadows and removal of fat in those areas if you looked at one of my markings today. So that's what I would change. I would keep the red markings on the breast, as I mentioned before, the green and the purple markings. Obviously, if I'm going to perform a superior medial pedicle breast reduction. Okay. So those are markings. You see one last thing I didn't mention. You see the number 10. It's in three places, not four. Typically put it in four places, but I figured that was redundant at the time. The 10 to me in this patient, and it is not 10 in everybody. She is a 10. I know she thinks she's a 10, and she is a 10, but it represents the distance from the center portion of the body, if we're talking about the chest or breast, over to that middle portion of the chest, that red line is the midpoint of that. That's 10 centimeters. And it should be 10 centimeters on the other side. Again, to make sure that I align the breast up and particularly the nipple. Again, you see this 10 centimeter number below. That's a distance between from the center of the tummy out to these meridian lines of the tummy. But again, I don't do that today because those lines don't mark up and it doesn't make a difference in my hands where those lines are at the end of the procedure on the table. Because when I walk away on the table, from the table rather, I want this to look pretty darn nice. I mean, I want to go, yep, there's nothing else that needs to be done or could be done. So, having said that, one last thing before I show you the final picture of the on the table result to kind of help this make sense, because I know some of you may ask or wonder or go, oh my gosh, I want you to focus in on the center of the chest, right where the breasts in the middle meet together. As you can see, the breasts start pretty much, if you look right here, right. And I'm gonna lift up right together. That crease as it goes down and around, they're together. Sometimes that crease starts further away, and I'll use the upper chest so you can see me. Sometimes that crease is together. Sometimes the breast starts further away at various distances. Her breasts start almost at the same point in the center of her chest as it creates the crease and roundness of the bottom of her breast. So you'll see why I said that in just two shakes. So here is the on the table final result. So there. So as you can see, we ended up with an inverted T type of incision. As you can see, the crease incision meets all the way to the center of the chest and goes to each side of the breast. There's no way I could there's no way I could avoid that because the breast started there naturally. If I did not connect those incisions, you have a big fullness of unoperated tissue there that would look really weird. This will settle down and this area, these breasts will kind of soften and cover those crease incisions, and you won't know the difference. The Let me just kind of give you references of where these marks ended up, especially for the breast. If you remember, the top part of the snowman, the green, would represent the outside of the newly positioned or the perimeter of the areolar. That's where that represented. The wide green body actually is represented in the finished product as this straight up and down line from the edge of the new nipple placement down toward the crease. The crease incision wasn't really represented in the markings, and for me it never is, because I like to figure out how much crease incision I need once I'm on the operating table and in real time. So I kind of mark that and determine how long the crease needs to be on the operating room table to achieve the best result. As you can see for her, she's definitely lifted. She still has good volume, and she is, much better shape than when she started. You can see for her tummy, the lines aren't present because I removed them all, but you can see the belly buttons in the middle. That red line down the middle helped me center that. The incision is as advertised. Her shape is really good. You can kind of see the outline of her waist. And so, again, with the liposuction added to the tummy tuck, gives the best shape, in my opinion. There are a lot of docs who out there who are a little hesitant to really liposuction at all, or liposuction definitely aggressively when they are performing a tummy tuck, because there has been literature in the past to show that there may be a decrease in circulation, and that may increase wounding. With newer techniques and new methods, techniques, you can liposuction aggressively. And I think younger surgeons are definitely doing that. And I'm part of that group. I like to consider myself young and cutting edge, at least. I may not be young from an age standpoint, but like to be cutting edge. And so I liposuction with my tummy tuck, and I'm able to tell how well the circulation is during the operation. So I've not had any really abnormal outcomes from doing that. So I think the patient or the client gets the best benefit from combining tummy tuck and liposuction. So again, just wanted to jump on here. Got a little long-winded, sorry, but I think this is good information. Or if you're curious, at least you can kind of satisfy that curiosity. What do these markings mean? Again, every surgeon has his or her way of marking and what that represents to them. This is just the way I do it, and I thought I'd give you a little insight. So with that being said, I like to thank you for tuning in. Remember, if you like this or you have questions, leave comments and questions below. If you think somebody could benefit from this, share that and then invite them into community. This is part of being in the community. You won't find this on Facebook. You won't find this on YouTube. You won't find this anywhere but here. So with that being said, it's late. I better get out of here, or my boss at home is going to be really mad. I hope you guys have a good evening. Take care.
My life, my life, my life, my life in the sunshine. Yeah, yeah. Everybody loves the sunshine. Ooh, sunshine. Yeah. Everybody loves the sunshine. They really love the sunshine.